Hi, Clark Britton. How are you guys doing today? Today I'd like to talk to you a little bit about the external genital structures in women and some of the things that happen to them that are problematic for the patient. And I hope we can give you some insight into some things that you can do to help relieve these problems. One of the most common things I see is called agglutination or fusion of the labia above the clitoral hood, and women who become menopausal lose all their hormone support, and those tissues kind of get stuck together and atrophy over time because of lack of stimulation and lack of hormones. Think about this: if you go to sleep and you sleep a long time, your eyes kind of get stuck together and you have to rub them apart a little bit to get the matter out of your eyes. Well, imagine if you didn't do that for years and years. You wouldn't be able to open up your eyes. Well, that happens to some women with their genitalia, and we call it vulvovaginal atrophy, craurosis vulvae, phimosis, and these things can cause discomfort, lack of sensation with sexual stimulation, burning, itching, irritation. Another condition we see a lot is called lichen sclerosis et atrophicus. I won't give you a lesson in Latin or anything like that today, but we abbreviate it LSA, where plaque-like areas occur on the genital structures of women, occasionally on men, typically on the labia majora, sometimes on the labia minora, where there's a plaque-like or whitish growth of the skin that's a thinned out area and an abnormal growth that sometimes is hard to distinguish between that benign condition that happens in 10 or 15% of women from a malignant condition called cancer of the vulva. There's a couple pretty good treatments for that, and I'll get to that in just a minute. We also see a condition called vulvar vestibulitis. It's not so much a lesion as it is a condition of the opening of the vagina, right at the entrance to the vagina, where the glands get a little bit tender and makes it impossible to have vaginal intercourse. I'm going to go through these real quickly, and then we'll go to the next topic with another podcast. But the hormonal effect of the tissues getting stuck together, number one, you want to treat it with hormones. If women are deficient in estrogen and testosterone, replenishing that can go a long ways toward making those tissues feel better. Topical therapy tends to work better than systemic therapy. We also do a topical treatment where we put a cream on those tissues and make them numb so that we can come at you with a CO2 laser beam to rejuvenate those tissues with an ablative CO2 laser beam, or the P shot, or rather the O shot, which we use regenerative cells from platelet-rich plasma to inject under the skin where those tissues are stuck together to help rejuvenate them with pre-stem cell therapy that helps them come alive again. Hormonal therapy, sexual stimulation, O-shot, and laser therapy are really effective for that. Lichen sclerosis can cause significant discomfort and prevent a woman from being able to have intercourse or have pain and bleeding with intercourse. Again, it's treated with sometimes with hormone therapy. A lot of doctors only know to use steroid compounds that are potent and potentially have a lot of adverse reactions. But we like to use the CO2 ablative laser, which is very effective, and sometimes we use PRP injections like we do with the O-shot. And then finally, the vulvar vestibulitis is a fascinating condition. Usually, not always, is associated with a decline in estrogen levels systemically and particularly in the tissues of the vagina. We see it a lot, particularly in women who are menopausal. They've had breast cancer. Their doctors have said you cannot take any hormone therapy. We can actually use that same laser beam that we talked about for the external structures to treat that vulvar vestibulitis very successfully, and it also helps with vaginal lubrication, elasticity, and sensation. So those are a couple common conditions that we see: lichen sclerosis, atrophy, and agglutination of the labia, and vulvar vestibulitis. All of them have treatments that are very successful, and we hope if you have a problem like that, you might give us a call that we might help you. Thank you very much.